The coronavirus is not taking the holidays off, and health experts fear people gathering to celebrate will make a bad situation even worse. The nation hit another record Friday with more than 205,000 new infections. That is a single-day high, with many states not even reporting. The U.S. leads the world with more than 13 million infections, and the virus has killed more than 1,400 Americans Friday, pushing the country's death toll to nearly 265,000 nationwide. Almost 90,000 people are hospitalized with COVID-19. Los Angeles County, which is the nation's largest, issued a new stay-at-home order to deal with its spike in new cases. All this, as a panel of health experts is due to meet to discuss how to distribute the initial supply of a COVID-19 vaccine. Michael George has the latest.
Spiraling cases have already put more than 90,000 people in the hospital, even before the shopping began. 66-year-old Shelley Dunn is one of them, and lucky enough to be able to talk.
It's really frightening. I thought an asthma attack was frightening.
Stories from people struggling to stay alive are still not deterring holiday shoppers and gatherers or giving healthcare workers a break.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
Before Thanksgiving, 32 states saw increases in new daily COVID cases, with Pennsylvania, Arkansas, and Massachusetts breaking records. And in Oklahoma, the officials are getting pushback from the Nurses Association after it decided to allow nurses who test positive to work.
It is a mixed message to the public to allow asymptomatic COVID-positive nurses, physicians, and other healthcare workers to work.
But in Vermont, Governor Phil Scott told residents of his state social gatherings have consequences.
If you are going to have a gathering with households outside of your household, we're asking you to tell us that you shouldn't send your kids to school next week, that you should quarantine your kids for at least 7 days, get a test.
The County of Los Angeles banned public and private gatherings for anyone outside a household, though religious services and protests can take place because they're protected by the Constitution. And a 10 p.m. curfew in San Antonio, another attempt to slow the spread, has been disparaged by bar and restaurant owners.
It is nonsense, and it's not fair to the citizens of San Antonio. They're grown adults. They can make their own decisions about whether they gather and how they gather.
As people continue to play tug of war with the coronavirus, the vaccine is expected to get another push down the fast track Tuesday when the Centers for Disease Control holds an emergency meeting.
And at that emergency meeting, advisors will vote on who should be vaccinated first. Health experts recommended go to frontline workers, people with existing medical conditions, and those over 65. And yesterday, the FDNY also recommended that its members be vaccinated as well. In New York, Michael George. Omar, back to you.
Michael George, thank you. For more on the coronavirus crisis, I want to bring in Dr. Celine Gounder. She was recently appointed to President-elect Biden's COVID-19 advisory board. She's an epidemiologist and infectious disease expert at the NYU Grossman School of Medicine and Bellevue Hospital in New York. Doctor, thank you for joining us. We saw millions of people traveling the last few days for the holiday, despite CDC warnings, and hospitals across the country are already at capacity or close to it. How bad do you think it's going to get in the 2 weeks after Thanksgiving?
Well, we know it can take up to 14 days for somebody to develop symptoms after they have been exposed. So we fully expect that in about a week or two after Thanksgiving, we will see an increase in cases first. Then about a week or two later, you'll start to see an increase in hospitalizations. And then another week or two after that, you'll start to see deaths. And so unfortunately, that means that many people who celebrated with family, with friends over Thanksgiving will find themselves in the hospital, in ICUs over Christmas and New Year's.
If people have traveled, if they have gone to grandmother's house, what should they be doing to protect themselves and others there and once they return?
Well, prior to travel, you should ideally be quarantining, which means really not being exposed at all to other people outside of your household bubble. And so right now, the quarantine period is for 14 days. We may soon be able to shorten that based on some more recent data. So possibly we might recommend, say, 7 to 8 days with a test at the end of quarantine. But you still need to look at doing that. And then once you get there, still wearing a mask, everybody should still be wearing a mask, social distancing, so that's 6 feet apart, and have your gatherings outdoors if at all possible, whether that's around a fire pit or maybe it's a family hike and a picnic. But if you do have celebrations indoors, to open your doors and your windows wide so that you have maximum ventilation in those indoor spaces.
We'll talk about New York right now. The U.S. Supreme Court struck down an order on Thursday that would have limited the number of worshipers and services there in New York. That ruling was specific there, but it's an indication that the government may not be able to issue certain orders that could slow the spread of the virus. So how does that affect all the public health efforts if the states don't have that kind of power?
Well, look, I'm not a lawyer, so I can't really weigh in on the legal side of this, but we do know that gatherings indoors, especially crowded gatherings with many people, whether that is for a religious service or a music concert or going to the mall, any of those where you're in crowded spaces around other people, that is going to significantly increase the risk of transmission. And so from a public health perspective, we are concerned that these could be sites of transmission.
As we mentioned at the top, you're on President-elect Biden's task force. What does the country need to do in the next few months? I don't want to say slow the spread, but at least slow it down to a point where hospitals are not going to be full like they are now, especially here in Texas, where I'm at.
Well, this is what we were talking a lot about in the spring and summer, this idea of flattening the curve so that hospitals are not overwhelmed. And unfortunately, healthcare workers have now been fighting this for months. They, too, would like a break for the holidays to see their own family within their household bubbles. And we, normally we have skeleton crews functioning in the hospital to allow for that to happen. Unfortunately, I think some people are going to find themselves having to work the holidays to meet the surge. And on top of that, you have more transmission occurring secondary to the holidays, which is on top of a really big surge that we're already seeing across the country even before that.
And finally, last time we spoke with you, you hadn't had any communication yet with the transition team. Has that picked up as we get closer to January 20th?
Well, the transition team, members of the transition team and of the advisory board are now meeting with members of the administration. And, I do have to say we've been happy with how civil and cooperative those conversations have been. But remember, you have a lot of career bureaucrats, and I mean bureaucrats in the best way possible, people who have dedicated their lives to public service, who are really just invested in seeing a smooth transition here.
Well, we shall see what happens, obviously, on January 20th and how policies change, because I know a lot of people who trust the science are paying attention. So, Dr. Celine Gounder, thank you very much for your time.